The Felton Research and Training Institute, in partnership with the University of New Mexico, is currently implementing the mPOWR model, a shared decision-making toolkit that uses an assessment questionnaire and decision aids in order to improve the quality of life for people suffering with mental illness.
What we're going to do is we're going to start with the mPOWR questionnaire.
The mPOWR is a well-structured, accessible tool that would allow a relatively either sophisticated or untrained clinical staff person to become aware of how they're interacting with somebody who's coming in as the client or patient. We're saying in shared decision-making, it should be collaborative discussions that lead to a mutually agreed upon decision.
Okay, so these are the things that you get to pick out that you want to work on.
The mPOWR, available in English, Spanish, and Chinese, is currently being tested in rural New Mexico and inner-city San Francisco in a study funded by PCORI, the Patient-Centered Outcome Research Institute.
When I first started, we had case management, and case management was really a job where you worked with people and you made sure their life things were taken care of.
While traditional case management is often hierarchical, situating the provider as the expert in charge of directing client care, research in community-based mental health settings has found that patients feel they're not being heard and feel left out of their own care planning.
I want nobody to have to feel the way I have felt all this time. To be understood by people that don't understand, to teach them to have patience.
In a departure from a top-down model, the mPOWR toolkit reflects a positive shift toward a consumer-driven approach where clients take much more responsibility for their own recovery and are prompted to take action steps in making their recovery tangible and successful.
It's client-focused, it's empowering the client. It's assisting the client to set goals for themselves, other than me coming in and saying, okay, we're gonna do this, this, and this. They take the lead, and I just kind of stand behind them and support them, to make those steps to reach those goals.
The mPOWR begins with the provider administering an evidence-based questionnaire composed of the World Health Organization Quality of Life, BREF, and the Community Life Skills Scale. After identifying consumer priorities and needs, agencies are able to track baselines and measure outcomes over time. The mPOWR Toolkit has a care planning tracking sheet that helps designate tasks to be taken between sessions. This supports the consumer in obtaining multiple resources and allows a process of empowerment to occur as they take small steps toward their own recovery.
So thinking back to the last 2 weeks, how would you rate your quality of life? Very poor, poor, neither good nor poor, good or very good.
The decision aids help to guide the collaboration as they correlate to a set of 6 different life domains that have been identified through the evidence-based mPOWR questionnaire. These include physical health, psychological health and recovery, social relationships, environment and activities, vocational skills, and personal care and daily living.
The decision aids are helpful because it kind of dives deeper into understanding where the client may be suffering.
By delving deeper, the decision aids bring to surface some issues that the client and provider may not have become aware of had the questionnaire not been administered. And, as a communication tool that can be used many times over, the mPOWR is updated annually to improve upon the ongoing utility for providers.
When we were working with my client to where we implemented the mPOWR, it actually assisted him in a way that it helped me as his case manager to get to him. For me, it worked. I can say that it was a good tool.
I like mPOWR, and my clients like it. It's because it's more detailed to each person. That they have a voice.